Depression can be so tough, and our counselors are aware of that. And we're not scared of hearing whatever it is that you're going through. We're very much so trained in working to address the different symptoms and things going on with depression. And some of the ways that we do that are to utilize cognitive behavioral therapy, which helps us work on how do our thoughts, our feelings, and our behaviors all connect together to impact how we're feeling and to shift some of that, because a lot of depression can include rumination about self. So, this negative self talk that just kind of continues and we tend to spiral with. And then we also utilize dialectical behavioral therapy, and DBT can kind of help us with emotion regulation and kind of walking the middle path instead of being so black and white, good or bad, wrong or right. We shift to a place of um, wisdom in our thoughts and our decision making, and it can really help us with regulating emotions. And then we also utilize EMDR, which is a trauma therapy, and that can be helpful for people who have experienced a trauma in their life that has contributed to them having depressive symptoms. We also use mindfulness, and mindfulness is really getting connected with your present, getting connected with the here and now, and noticing how that's impacting symptoms. And then we're also trained in working with internal family systems. Some of our therapists are, and internal family systems can help you really kind of getting to know the different parts of you. Sometimes there's this part of you that's a high achiever that shows up for work every single day. But then you get home and you feel terrible. And then that part of you is drained and sits on the couch and maybe has a couple of glasses of alcohol and just kind of shuts down. So we have these two parts that are experiencing two very different things, and yet depression is still there. For so many of our clients, they struggle with really talking to people about what it is they're going through. We don't know how to say it. And sometimes when we talk to people, they say, well, just get out of bed. And they don't get it. They don't understand why it's so difficult, or they don't understand why we pull away. And so if you're finding yourself doing that, just know you don't have to go it alone. There's professionals that can help you walk through these symptoms, work to figure out what's going on, and find some relief. Common symptoms for depression. I'm just going to pull them up here because I wanted to make sure I shared all of them. So, common symptoms of depression that we tend to see are lack of sleep or excessive sleep. We might even see people who struggle with depression after they sleep, even though they've slept a long time, they still feel exhausted. We might also see other symptoms, including excessive crying or lack of emotions, feeling low mood a lot of the time, having lack of energy, lack of motivation to complete tasks, persistent sadness, emptiness, or hopelessness, difficulty concentrating or making decisions, sleep disturbances, difficulty with enjoying things that you used to enjoy, thoughts of death, thoughts of self-harm, loss of interest or pleasure in things you used to enjoy, fatigue or lack of energy, feelings of guilt, worthlessness, or self-criticism, and changes in appetite. And some of those may have been repeated there, but it can be good sometimes to recognize that sometimes we don't even realize that what we're dealing with is depression. A common one that I find in people is that they notice that they're angry and irritable a lot of the time. And a lot of people don't think of that as depression, but that actually can be a symptom of depression because we've got that irritability. We're not just feeling as happy or as good in our everyday life. So that's something to take a look at. And our therapists are trained in working with that. So we'd love to help you. Feel free to reach out if you need any support.